Hi, so I'm Jean-Luc Bressard. I am the CEO of HexTransforma Healthcare. I live on the south coast of the UK near Brighton, and the company is based in Brighton, the lovely coastal towns of the United Kingdom. Yeah, my background, I started off life actually in accountancy. So I'm one of these people who trained as an accountant, but then decided that I didn't really want to be an accountant. And then I moved into the world of management consultancy, where I worked for best part of 20 years, working for tier one management consultancy firms. I was very lucky. I managed to travel extensively and work overseas, pretty much in Latin America, North America, Europe, Asia, before founding my own firm back in 2008, which I continue to run and manage up until about 2015. So that was my background. My specific sort of interest in medical technology was at the latter stages, probably the last 8 to 10 years of my career in consultancy, where I was working with medical device companies and healthcare companies, and took a really keen interest in clinical pathways, healthcare medical devices, IoT technology. So that's pretty much what led me to where I am today. We decided to create HexTransforma Healthcare. I think it was in London. I used to be a member of the hospital club, the famous hospital club in Covent Garden, which is ironic. And it had nothing to do with medical technology, but it was a members club, and myself and my co-founder decided to found the company HexTransforma Healthcare back in mid 2016. And we had a vision. We wanted to improve clinical pathways. We wanted to fill the gap that exists in all pathways, which is that gap in between clinical appointments. What is actually happening? Who is assessing a patient? What can we learn from data if we were utilizing IoT and wearables? What can we learn about the data being emitted by the patient that we can incorporate and provide to clinicians to improve the treatment and hopefully to improve the outcome? So that was our vision. It was harnessing immediately available and emerging technologies to assist clinicians and to assist patients in their treatment. The BritMed platform was designed to provide a safe and assured treatment pathway for medical tourists. It's a term that is somewhat nefarious. We use it hesitantly, but medical tourism is a thing. It's a massive industry. It's a substantial industry. Many organizations and many countries are investing heavily in their own infrastructure, clinical infrastructure, to encourage patients from overseas to come and seek treatment in their countries, whether that's Malaysia, Singapore, the Emirates. It is commonplace and increasingly will be commonplace. The challenges that most patients face at the moment are multiple. Firstly, language. We as the British people are notoriously known for not speaking many foreign languages, which presents with itself challenges. How do I know that this clinic in X country is a good clinic? How do I know that they are well regulated, as our hospitals are regulated here or across Europe and the United States? How do I know that the clinician has the appropriate qualifications? Well, we don't. And fundamentally, the other thing that we also don't know is we don't have an accurate comparator to measure individual clinics against each other in different locations in the world, or individual clinicians and their outcomes and the feedback from their patients. So I think they're a minefield of issues, multitude of issues faced by patients in different countries. And BritMed is designed to attempt to remove some of those initial challenges, to level the playing field, to ensure that patients are comparing apples and apples, and they are doing so in a safe, and secure environment. So, we really want to bring great clinicians together with patients in need of good treatment. So that's our vision. The Hex Orthopede suite of products is a platform as a service offering that we have been developing for well over 12 months. The concept is simple. So for musculoskeletal health, we want a single interoperable platform that interfaces through APIs to existing systems within the health infrastructure. But every clinician on that clinical pathway has that single view of that customer. Now, earlier I mentioned to you about the vision behind the HexTransforma was the creation and the filling of that data void in between clinical appointments. Well, Hex Orthopede effectively utilizes machine learning and wearable sensors so that patients in between clinical appointments are providing data on their quality of movement, and we're capturing that data. Now, you're right to say it's technology that is bleeding edge, but it's not space age, it's not fantasy technology. This technology exists in gate laboratories already inside academic research institutions. We're effectively taking that technology and putting it in the IoT world so the patients can wear it and have it at home. And what it means is we can see that patient's quality of movement. We can identify the deterioration of that quality of movement. We potentially will be able to triage patients at the front end of a clinical pathway by effectively saying, of the 9 million people in the United Kingdom that have musculoskeletal conditions, these are the patients that require the most urgent treatment. And then at the back end of it, what we're attempting to do through our remote monitoring of vital signs, as well as combined with the data we are accumulating through the quality of movement, we can start looking and trying to identify patients with incidents of complications, post-operative complications, or potentially post-operative infections. And the data that we will gather and harness as we rapidly deploy the solution to millions of patients will start to really inform potential health policy. And it seems a stretch, but let me leave you with this thought. We know, because I think we're all guilty, I certainly am, we know that patients do not necessarily follow the clinical advice they are given, particularly when considering physiotherapy. We're all a bit, blasé about it. Do we do our exercises? Well, wouldn't it be great if we could actually see performance of patients who carry out their physio exercises to the letter against the recovery of patients who don't do it at all? What is the implicit cost to the state of that? But actually, what it also enables us to do is to target specific treatments to specific patients with specific illnesses and improve those treatments, because we now have a gauge, a method, and a mechanism to measure the improvement and the quality of their movement. So we see a huge opportunity here, not only to improve efficiency within the pathway, but also to reduce the break points in the current pathway where data can be lost or letters can be lost. And if we automate end-to-end that pathway, we free up clinical time, right? And which means our doctors, our physios, our pain managers will have more time to treat patients as opposed to doing admin. And of course, that is incredibly welcome when we consider the COVID pandemic and the other things that left field come out and hit our NHS or our health systems. It is a real wake-up call to all of us. And by that, what I mean is this: not so much that we could have prevented it, but from a medical technology perspective, I think COVID and the COVID-19 pandemic allowed industry, allowed governments, allowed clinicians to understand the real value of technology within a pathway such as treating COVID. I think One of the biggest barriers and one of the biggest challenges to all new technology is obviously data, and it is a serious challenge that is seriously brought by many people. What is my personal data used for? And health data is the most sensitive form of personal data. We acknowledge that. But with the correct security measures in place, unleashing technology, unleashing cutting edge technology securely in the health sector will be beneficial to patients, will be beneficial to clinicians, and we need to harness that. And I think the use of technology during the pandemic has clearly proven that it has a rightful place in treating conditions, health conditions throughout the world. And frankly, it is a catalyst to improving how we treat disease and how we treat patients. And I would also go as far as saying that we will see outcomes improving as we harness technology and we harness data and we apply the learnings from that data, the accelerated learnings from AI that AI delivers onto treatment pathways to improve patient outcomes. I think that is one significant learning, one could say a significant blessing that has come out of a truly awful situation and a truly awful period in our time. Actually, what I have seen in human behavior and human endeavor, I have personally witnessed members of my team who have gone above and beyond in their behaviors and in how they've worked and how they've managed staff. And I think that resilience and that kindness, that need to support counterbalances a lot of the negatives. And it also, I think it brings us stronger together as individuals, as companies, as family units. Yes, it divides as well, but where it is positive, I think it does solidify and it does strengthen. So I have been delighted at individual performances, collective performances, through the business, but there have been specific individual performances that really have just blown me away. And I couldn't be more proud to be leading a team of people who behaved and responded to the pandemic in the way that they have done. My hobbies, being a father of two, one teenager and one almost teenager, means that my hobby is probably parenting, and I think I'm trying to improve on my skills as I go along. I have been known to swing a polo mallet every now and then, and I'm an avid lover of motorcycles and all things fast, such as cars and boats and stuff. But I tend to my most favorite hobby is obviously my family and my work. We're very little time away from my desk. I'm shamedly team coffee. I drink far too much coffee. Should stop. Fun fact about me: little known. I raced in the British snowboarding championships. Whoa, I'm showing my age. More than 20 years ago on a slalom snowboard, many years ago, and I didn't do too badly, but I certainly wasn't in medal contention. There are several mottos, words that I do live by. I think the first is intellectual curiosity, and the second is talks to anything is possible or nothing is impossible. Oh wow, useless talent. That would first require me to admit that I was useless, that I had a talent that was also useless. I don't know. I think a useless talent of mine is probably I'm actually quite good at clay pigeon shooting. It's a totally useless talent to have. It probably doesn't help me in my day job, but I enjoy it. Yeah, it's good for nothing else but clay pigeon shooting. There you go.